Back everyone, spring is in the air, and as we've been reporting, for many of us, that means our allergies are in full bloom.
And if you are one of the millions of people who suffer from allergies like we do, there are some steps you can take to try to lessen your symptoms. Dr. Rob Danoff, the Program Director of Family Medicine Residency. Hey, Dr. Rob from Jefferson Health, joining us live now. Always great to have you on the show. All right, Dr. Rob, allergy season, we had to have you on because so many people are dealing with this right now. And I think one of the things is knowing what your triggers are. How do you determine what exactly is causing your allergies? Is it pollen? Is it mold? How do we figure it out?
Just follow Jim. It's like this is the season. Some people around March, April, early May, they have sneezing and itchy eyes and all that stuff. And it's a certain time of year. It's called a seasonal allergy. And right now it's tree pollen. But then the end of May and June, we grass pollen, and then we have a break for a few weeks, and then ragweed pollen in August and September. So if you're someone that says, Doc, at this time of year, I tend to get like all these symptoms. What do you think's going on? I said, it's those pollen allergies.
Well, let me ask, you mentioned the watery eyes, the runny nose. Are there any other symptoms that come with allergies?
Yeah, itchy eyes. So many people, oh, Doc, my eyes, they bother me. It feels like there's something in there. A stuffy nose. People who have asthma, this time of year, it may tend to be worse. They may tend to get more wheezing. Some people get really tired because their body's like fighting all these allergies. Some people get headaches because their sinuses act up. So there's lots of different symptoms that can occur with these allergy seasons, and lots of itching and sneezing for sure.
Now, you don't have to suffer through this. I know for me, I went to my doctor and she gave me, Flonase, and she also has me taking some of those, allergy pills. What do you suggest people do?
Certainly talk to your doctor. There are different medications. You mentioned a nasal spray, which is like our first line. Eye drops are certain allergy drops for your eyes, or if you have asthma, make sure you have the right inhalers. But there's some common sense things that you can do. First of all, check the pollen count, because you want to know, like this time of year with tree pollen, as soon as the sun comes up, the trees release pollen. So it's higher in the morning around noon, and then grass pollen, it's higher in the afternoon. So it depends on the pollen count. On dry, windy days, the pollen count is high. Keep your windows closed. Use air conditioning, because that pollen could just zip right through your house. And wear a face mask like Jim does when he's out in the garden or mowing the lawn. Those are some good things to do. And then when you come in from the outside, you have pollen on your clothes. So just take off your clothes in a certain room of the house and then go take a shower and wipe off all that pollen, so you're not circulating in your home. And then also, again, like Janelle, you do, talk to your doctor or healthcare provider about different things that you can do as far as medications, because thank goodness there's lots of medications we have. And I always tell people, if one antihistamine doesn't work for you, let's try another one. It's like finding the right ingredient that really helps. And you know what? Sometimes those saltwater nose sprays, it's almost like a car wash for your nose. If you put that in there, it takes the pollen out of your nose, so it's not as irritating.
Our floor manager, Nikki, does the neti pot thing. I'm not into that. No. I'm just taking my pills and my sprays. Can people get allergies later in life?
Yeah, it's not that common, but here's one of the most common things. Say you live in a different area of the country or the world, and then you move, say, to our area, which tends to have very high pollen counts. That can trigger allergies because your body is not used to it. So if you're a mover, also, if you're someone who had a lot of allergies as a kid to different things or had like eczema type of stuff, you may be more prone to developing later on in life.
Interesting. I love that analogy you gave us, though. A car wash for your nose. Okay, I'm going to remember that.
That's a visual.
Maybe, Jim, you can demonstrate that.
Oh, no.
That's for our next segment. Dr. Rob Danoff, always great to have you. Appreciate your insight. Thanks, Dr. Rob.